Our initial funding came from Blue Cross Blue Shield. That's how we actually got the program started about a year ago now. So we're really thankful for that initial funding that got us going. And now, a year into our program, we were fortunate enough to get this most recent grant from the DMC Foundation. And the way we got that, we're very fortunate because at our school, we have a professor who's really been helping us out on the administrative side, who actually does a lot of work, or has done a lot of work in the past with the homeless. He's written books about it, documentaries. Really, all of his work kind of revolves around that. So he's been really passionate about this work as well. So he's the one that actually reached out and was able to get this grant for us. So we're very thankful to him, Dr. Jason Wasserman. And kind of moving forward with this grant, of course, some of it is going to go towards our, our usual things that we need to have funds for, medications, different medical supplies. Other things that we hope to do is kind of improve like the preventative care that we're doing. So try to get some lab testing involved so we can be checking people's like HbA1cs for their diabetes, for their cholesterol, or other things like that. That's something that we would like to start integrating. We'd also like to try to do some more like advertising in the community. So hopefully when COVID kind of slows down a bit, we want to have like a sort of like a health fair where we can introduce ourselves again to the community. We can introduce our partners like Gary Bernstein Community Health Clinic, who we work very closely with, the Oakland County Health Division. We have a lot of people that we kind of want to get out there in the community and introduce themselves again, and kind of show that we're working together. So that's something we want to use the money for as well.
We're also looking into getting telehealth backpacks.
Yes.
So that's a really cool thing that's some of this grant money is going towards. We hope to use it a lot for mental health services. A lot of our patients that we see have mental health histories and they have trouble getting in to see psychiatrists or mental health professionals. So we're hoping that the telehealth backpacks will help us communicate with mental health providers while we're at the shelter or while we're on the street, and they don't have to be there physically. So in this time of that telehealth is kind of like skyrocketed, we're hoping to kind of get into that avenue of medicine and see if it can help our patients. And when we're not using it as a street medicine program, Gary Bernstein Community Health Clinic will be able to utilize that as well to kind of do telehealth visits with specialists if their patients need a specialist. So that's something really exciting that this grant is going towards too. Yes. So yeah, we're really thankful that we were able to secure this grant money and continue improving our program.